Hello, and thank you for coming to my presentation. Unfortunately, I was not able to attend live as I'm a student who is in my first week of a new co-op position and can't take time off as today is our training day. With this being said, I hope you enjoy this pre-recorded presentation and please feel free to reach out to me regarding any questions or to have further discussions about what I presented today. So with this being said, welcome to developing a machine learning model for automated scoring on the cube in cognitive assessment, a pilot study. My name is Laia Shpeller. That's a picture of me on your screen. And as I mentioned, I am a student currently in my third year of an undergraduate degree in biomedical engineering at the University of British Columbia. Over the fall term, I was awarded an NSERC grant to collaborate with Dr. Zara Musavi from the University of Manitoba and Dr. Panos Nasiopoulos of UBC to dip my toes into the worlds of research and machine learning. Today's presentation will begin with an introduction to my project, followed by the methodology used, the results, and a discussion and conclusion drawn from said results. Psychological assessments are often used to help assess cognitive impairments. Standardized psychological assessments for cognition, such as the MoCA, known as the Montreal Cognitive Assessment, and the ADAS-COG, or the Alzheimer's Disease Assessment Scale Cognitive Subscale, are often include visuospatial tasks. As you can see on the right of your screen, this includes asking patients to copy a cube which is marked as correct, receiving a score of 1 out of 1, or incorrect, receiving a score of 0 out of 1 by a trained assessor. While a seemingly simple task, the scoring of such tests can vary slightly among assessors due to the subjective nature of the assessment. Although tests such as the ADAS-COG have proven to be quite accurate for severe cases, studies have shown that such assessments may not be able to consistently detect mild cognitive impairments. This may be contributed by the fact that even one score higher or lower in these assessments can be crucial, as it significantly affects the evaluation and change in cognition of a patient before and after a treatment. As a result, the variability of scoring among assessors, particularly in multi-site studies, may lead to a systematic bias in the assessments. In this pilot study, our aim is to develop an image processing algorithm to score such drawings, automatically avoiding variability in scoring due to its subjective nature. A dataset of 185 cube drawings was collected from a current clinical trial composed of both MoCA and ADAS-COG assessments. For consistency, all data used for training and measuring the algorithm's accuracy was additionally examined by one trained assessor, where 67 cubes were labeled as correct and 118 as incorrect, thus presenting a lack of balance in our given data. Next, each image was cropped to form a perfect square, scaled to 240 by 240 pixels, and converted to grayscale. Further, an altered dataset was created where the grayscale images were converted to a binary black and white image using a pixel value threshold. The reasoning for this will be expounded upon later. Finally, these images were upsampled by randomly selecting correct cubes from the dataset using a uniform probability distribution to have an equal number of correct and incorrect cubes to train the model with. Thus, this reduced the bias relating to our initially unbalanced dataset. A third dataset was then created by augmenting 20% of the data. Correct cubes were augmented by adding a border of white pixels around them, and incorrect cubes were horizontally stretched to ensure both classes remained consistent even after augmentation. As specified previously, this left us with 3 datasets to hypertune and optimize 3 convolutional neural networks with. 3 final models with altered parameter values were created to best suit different datasets. The 3 sets were our scale data, or non-binary SD, augmented data, AD, and non-augmented data, ND, which included the binary pixels. These sets were chosen to represent the importance of having binary data and to understand the effects of augmentation. Furthermore, k-fold cross-validation was used to optimize these parameters. Then these parameters were trained and tested with an 80-20 ratio, and validation accuracy was measured. Parameters were determined by storing trial results in a pandas data frame and selecting the highest performing parameter combination. Early stopping was used to discourage overfitting of the model by monitoring the validation accuracy with a patience of 15 epochs. Results of the optimized convolutional neural networks revealed that the ND, or binary pixel data, had the highest validation accuracy and balanced accuracy scores, with a slightly lower ROC-AUC than the augmented dataset. On your screen, we'll now look at the graphs of this ND, or binary pixel data model. One can see that early stopping assisted by reducing overfitting in the validation loss and accuracy curves, and a steady increase in accuracy and decrease in loss reveals the simplicity of the image and the model's ability to learn quickly and efficiently. Next, the ROC-AUC of 0.92 demonstrates the model's strong ability to distinguish between our two classes. And finally, the confusion matrix reveals a recall of 94%, precision of 81%, and a misclassification rate of 14%. We have initial evidence to show that a machine learning model could reliably be used to score subjective visuospatial tasks. The results of our pilot study show an accuracy of 85.7%. This is encouraging given the inter-rater reliability for a cognitive assessment has been shown to be 88% in previous studies. However, we do acknowledge that our presented model accuracy is biased since we use the entire data set to derive the parameters for the model. Nevertheless, future studies using larger samples will most likely increase the accuracy and reliability for the automated scoring model. Thresholding was used to simplify the cube image and remove the bias related to the shade of the image. The cutoff value of 225 out of 255 was chosen by testing various values and comparing the processed image to the original to determine the highest threshold which properly represented the entire cube. The benefits of this were evident in our experimental results. As you can now see on your screen, while strong at classifying many cubes, the model showed inconsistencies in classifying rectangular or non-parallel cubes. This inconsistency is a limitation of the training data and the inconsistencies in the initial classifications. The MoCA criteria for scoring a cube drawing are not explicit, requiring an assessor to determine if lines are, quote, parallel or straight enough, end quote, hence leading to the inconsistencies in classifying the cubes. Furthermore, this might relate to why the augmented data or AD dataset hurt the performance of our model. Further experimentation is needed for improving accuracy and reliability. This could include, but is not limited to, using HE initialization, experimenting with optimizers, and using cross-validation before selecting parameters to ensure a high blind test accuracy. To reduce the inconsistencies within classifying the training data, multiple assessors could classify all the data, and a voting system could be used to determine the final classifications. This can help bolster the data presented, so as the model is no longer learning from data from a single trained assessor, but now averages out the assessor bias. Finally, a further experiment could involve having multiple assessors classify a data set and comparing these to determine an inter-rater reliability score for human scored assessments. This score could then be compared to the reliability of the CNN model to determine if its effectiveness and if it is in fact beneficial to supplement human assessors. The results of this pilot study are encouraging for using machine learning and CNNs to remove assessor bias and inter-rater variability when scoring visuospatial tasks such as the shape drawing in standard psychological assessments, particularly in drawing a cube. Further investigations could quantitatively determine if the model exceeds the reliability of human scoring and shape drawing, and whether finer tuning of the model's structure could lead to improved validation accuracy and precision. With this being said, I want to say thank you for attending my talk. As I mentioned, I really do apologize for not being able to attend live today, but I do ask that you reach out to me at laiashpeller@gmail.com with any questions or to have any further discussions. I also want to extend a thank you to the Natural Sciences and Engineering Research Council of Canada, or NSERC, for providing an undergraduate student research award to finance this project.